Hi guys, Christina here, and as always I'm with my dad, and it's time for another edition of the Weight Loss Soundbites. This week we're going to talk to all the pre-op people, or the people, you guys who are thinking about having the surgery, and you want to know what are some good questions to ask potential surgeons, and what are some warning signs that should make you look for a different surgeon to have do your surgery.
The first is, are you comfortable with them?
Mm-hmm.
Sometimes it's just a personality or a bedside manner kind of thing. Might be an excellent surgeon, he might be technically very excellent, he might be, everything might fit, but if you're not really comfortable, remember you're putting your life in this guy's hands.
Mm-hmm.
So you need to be comfortable with them. But some of the questions you can ask are they board certified?
Mm-hmm.
How long have they been doing bariatric stuff? How many surgeries have they done? How many times have they had to go back in and repair a leak? Leaks happen, but if it's more than 2-3%,
Yeah.
might mean that the surgeon's technical competence is in question.
Mm-hmm.
Has he had any people? You probably won't talk about that, but how many people has he had die, if any? Again, that goes back to if it's more than 1% or so, I might look for a different surgeon. Are you comfortable with the staff? Are you comfortable with the hospital he works in?
Mm-hmm.
The staff is the surgeon and the staff are what make up the program. Their personalities, their drive, their compassion, their real desire to help people above making a Mercedes payment.
Mm-hmm.
We got lucky. We have a doctor, a head nurse, nutritionist, and several other
People. Yeah.
ward nurses and that kind of stuff that truly care. And that goes back to our doctor,
Mm-hmm.
who has only hired people who have a passion for helping people. I almost get the feeling sometimes that Jane would volunteer her time, even if she didn't get paid.
Yeah.
That's just the kind of person she is. And if the nurse is that way, it's because the doctor hired that person, because he feels that way.
Mm-hmm.
And you can tell, if you're comfortable with them, their bedside manner, you can tell if that surgeon really cares about you, or if he cares about the program, or if he just cares about the paycheck. Those are the big things in my mind. But I would also make sure that if they don't have a support group,
Mm-hmm.
that they want you to go to before and after surgery, and they make it available, and they encourage you to go, not just, well, it's there, if you want to go, you can go. They should be encouraging you to go, because I can't think of anything outside of the doctor's competency, outside of the support group, that's going to make you a success. Then the support group will. And that everything goes back to the staff.
Mm-hmm.
The staff that picks the topics that they talk about during the support group meetings, because they care about you. They know, they've done it long enough, they know how you feel, they know what you're thinking, they know the questions you want to ask, they know the questions you should be asking. Those are all things. The doctor, the staff, the support group. If you're smart, even if you're not, you should be doing research online on what different bariatric programs have. And that will ring in your mind some questions that you have concerns with. What kind of surgery should I have?
Mm-hmm.
And you should already have an idea when you go to the doctor, because you've already researched. You know what the Roux-en-Y, the gastric bypass is, what the sleeve is, what the band is, and that kind of stuff. So that when the surgeon, he or she, is talking to you, you know the lingo a little bit.
Mm-hmm.
You know the good and bad points. And then the doctor will look at you as an individual and say, well, you have this, you have this, you have this, and your blood chemistry, you have this and this. And so you could have one of these two surgeries, but I kind of lean towards this one. The surgeon should guide you to a decision, but once you make your decision, the surgeon should it should be your decision, not the surgeon's. But the surgeon should guide you. The surgeon should give you the scientific data as to why he thinks which surgery may be a little bit better than the other. And by that time you should have a rapport with the surgeon and the doctor. And you'll either respect their decision or you won't.
Yeah.
Or you'll have real reasons, like with you, he said it could be either one. And he left it up to you.
Yeah.
Either one would be good. So you have a buy-in. It was your decision. And it makes it important to you. And then he supported your decision.
Right.
And he told you why he supported it. And he told you what could happen, what couldn't happen, and what would happen if this happened, and how we may have to adjust the surgery during the surgery. So you knew it all before you even went in.
Yeah.
And that gives you a comfort and a confidence that's really necessary for success and for the healing afterwards and that kind of stuff. So those are the kinds of things I'd ask for. How many surgeries have they done? How many failures have they had? Either in deaths or having to go in and repair a leak, that kind of stuff. If you go to the support group meetings that they should have, if they don't, I'd run to find another doctor. But you go to support group meetings and you'll get a sense of how the other people think of that doctor.
Yeah.
And that'll bolster your decision, and it will confirm your feelings that this doctor, that you just weren't snowed, that other people like him. And you'll get to meet people post-surgery at the support group meetings, and they can talk about the care they've had afterwards and the compassion that the doctor has had during their 1 week after surgery, their 1 month after surgery, their 6 month after surgery visits. And has the doctor tracked them? Does the doctor talk to them when they go to the monthly support group meetings? Hey, how you doing? You looking good? Have you had any feelings? Do you have any questions? You know, it's a continual process, and that doctor should really care about you, not just the program.
Yeah. Well, that was one of the things that I was going to say. A question would be, what's your aftercare? Because it's really important that you have regular checkups. I had 1 week, was it 1 week or 2 weeks?
Usually it's 7 to 10 days after surgery.
A week.
And then take stitches out if you had any.
Yeah, and he checks the incisions, he checks for any hernias every time. Does blood work every time to check vitamin levels to make sure you're not becoming malnutrition, and if something you need to up something, like I had to up my iron or calcium or whatever, because I had the 1 week, then 1 month, 3 months, 6 months, and then 1 year. And they did all of that stuff every single time just to check your progress. And plus he sits there and he'll talk to you, and if there are any problems, any concerns, you know, that kind of thing. And my Dr. Peterson will sit there and he will, you know, have a whole conversation with you about what's going on in your life and how things are going, and has there been any difficult stuff. And if you have difficult stuff, he'll help you. And there's a nutritionist there, and if you're having an issue with, I don't know, something nutrition-wise, he'll call her in, and they'll sit there and they'll talk to you and kind of counsel you about, well, you know, you could try this or you could do that. Also, are they available, not just whenever you're going to have an appointment? Could you call him up? Could you email the nurse that works there if you have a problem that crops up between visits? Are they available to just, if you have an issue that comes up or a question that you really don't know, are they available for you to be able to contact them even if you don't have an appointment? That's another thing that my office is pretty good about. You can call, text, email, whatever, and they're always so glad to help, and eager to help and happy to help. And I think all of what you said, the feeling that you get when you're there, and are they knowledgeable? I mean, because he did sit down with me before and he said, well, you're pre-diabetic and you have this, and so he said it would be either the sleeve or the gastric bypass, but ultimately it was up to me because he thought I would be successful with both. And when I chose to do the sleeve, he was fully supportive and thought that would be a good option, thought that I would be extremely successful. So I think just they're there to care, and afterwards they don't just do the surgery and just shoo you out the door and say, okay, now you're on your own. I think that's a bad thing, because We need that aftercare. We need the support group. We need the experience that they have that we don't, because this is new to us and they've been doing it for a while. They've
been through a lot of schooling.
Mm-hmm.
Every once in a while I'll get a big head and I think I'm an expert because I've been through it and I've been doing this now for 6 years, 7 years, and I've seen it all, and I've been to all the support group meetings and I've heard them talk and I know what's going on. And then I'll go to a support group meeting and where Dr. Peterson talked about one time in the Roux-en-Y where they moved part of this up here, the intestine after 18 months or so starts to adapt.
Mm-hmm.
And it starts digesting stuff that it never did before because it's used to having it digested in the stomach, and so it's kind of modified its behavior from being a part of the intestine to being sort of part stomach, part intestine, and how it does it. And I'm thinking, wow, I didn't know that. Mm-hmm. This guy's pretty smart. He's smarter than me.
Yeah.
However, she's been through years and years and years of school to learn all this stuff, chemistry classes and biology classes, and the nurse is the same way, and the nutritionist, nutrition. I learned how to read labels, and I thought I was an expert. I can show you where all the sugar alcohols are, and where all the good stuff, and I can tell you why they're trying to hide stuff in the label. Yeah, I'm good. Then you go to the meeting, and the Ann will say something, I'll go, oh, never thought of that.
Yeah. Wow.
Because she's been to school. She knows the chemistry behind nutrition. She understands. I can remember one time when I was shocked because they told me before surgery I was low normal on B12. Mm-hmm. So after surgery they assumed I was going to be low B12. And I thought, well, okay, B12 is just a vitamin, it's no big deal. And then they told me B12 affects nerves. And the nerves, they had a lady come in one time who was about 6 months out of surgery, and she looked like she'd had a stroke. One side of her face was numb and was hanging. And they said, oh, and they did a thing, and her B12 was just way, way low. And she had nerve damage. And the bad part about getting low B12 and getting nerve damage is once you get back your B12 back on normal, it doesn't repair the nerve damage. She was stuck with a droopy face the rest of her life because she didn't pay attention. I'm thinking,
B12.
Got to have B12.
Yeah. And
how many other things are there that I don't know? That you could go up and tell the nutritionist, you know, I'm not feeling real good, and, you know, my feet get cold, my hands get cold. Oh, well, you need iron. Mm-hmm. Well, I didn't know that.
Well.
She knows. She's had training, years and years of training. That's why she's there to help. Mm-hmm. So ask the questions. And if you don't have that rapport with them, if they don't have the passion for their program to help individuals, that's not the place to be.
Yep,
but if you ask a question and they're all behind you, oh, we need to get you in, we need to check this level, because it could be this, this, or this, and we need to make sure we tailor, and we need to make sure if it's vitamin B12 you get it, if it's vitamin C you get it, if it's vitamin D you get it, because D helps you absorb calcium, and maybe you got all the calcium you can take, but you don't have the vitamin D, so you're not absorbing it right. They know all those interactions and dependencies, and I've been doing this 6 years, kind of part-time. They do it for a living, professionally trained. Trust them, use them, and if you, like you said, if you don't have access to them after surgery, it's doing you no good. You need to find a doctor, you need to find a program that has pre and post support.
I agree. It's very important.
And we got one.
We do. All right, well, I think that's it for this week. So we will talk to you next time. Bye.
Bye.